The shocking truth about COVID-19 vaccine uptake among cancer patients. What a study in Tanzania reveals. Imagine this. In the wake of a global pandemic that has claimed millions of lives, you'd think that those most vulnerable people battling cancer would be among the first to embrace a life-saving vaccine. Yet, a groundbreaking study from Tanzania sheds light on a concerning reality. Vaccination rates among oncology patients aren't as robust as one might expect. This isn't just data, it's a wake-up call for public health strategies worldwide. But here's where it gets intriguing. Why do some patients roll up their sleeves while others hesitate? And could this spark debates on how we tailor health campaigns to different groups? Let's dive in and unpack this eye-opening research, making sense of it step by step for everyone to understand. Research Spotlight: Open Access Insights into Vaccine Trends. Published on November 24, 2025, this open access article, available via Springer Nature's platform at https://www.springernature.com/gp/open-science/of-open-access-and-open-research, offers early access to its findings. Be aware that this is an unedited manuscript, so minor imperfections might exist before final polishing. All standard legal disclaimers apply. Authors and affiliations: David Makako to the power of 1, Anthony Kapesa to the power of 1, Michael Mugawa squared, Mam Saungoma cubed, Mark Messity cubed, Mary Liamo, Lucy Kisaka, Nchuli A. Kapalogwe, and Jeremiah Seni. To the power of 1 School of Public Health, Catholic University of Health and Allied Sciences Bugando, Mwanza, Tanzania. Squared Epidemiology Unit, 3 Insights, Kampala, Uganda. Cubed Ocean Road Cancer Institute, Dar es Salaam, Tanzania. School of Nursing and Midwifery, the Aga Khan University, Dar es Salaam, Tanzania. Ministry of Health, Dodoma, Tanzania. Department of Microbiology and Immunology, Will Bugando School of Medicine, Catholic University of Health and Allied Sciences, P.O. Box 1464 Bugando, Mwanza, Tanzania. Corresponding author, Jeremiah Seni. Published in BMC Infectious Diseases, https://bmcinfectdis.biomedcentral.com, article number 2025, cite this article. Abstract: Uncovering Patterns in Vaccine Acceptance Amid Vulnerability. Background: COVID-19 vaccination efforts have undeniably curbed the virus's impact globally, slashing severe cases and deaths. Worldwide statistics indicate that about 67.7% of the population has been vaccinated, with Tanzania boasting an impressive over 70% coverage for those aged 18 and up. Still, there's a pressing need for detailed assessments within specific demographics, particularly in sub-Saharan Africa. This investigation zeroes in on oncology patients who face heightened risks due to their compromised health by evaluating their COVID-19 vaccine uptake and the influencing elements. For beginners, think of vaccine uptake as the percentage of people who actually get the shots, and this study highlights how it's not uniform across all groups, urging us to explore why. Methods. Conducted as a cross-sectional analytical study in September 2022 at the Ocean Road Cancer Institute, ORCI, in Dar es Salaam, Tanzania, the research blended quantitative and qualitative approaches. For the numbers side, a multi-stage sampling method was used, stratified sampling to mirror the variety of cancer types and simple random sampling to pick 479 oncology patients. Qualitative insights came from purposeful sampling of 26 patients. Data collection employed the Open Data Kit, ODK, for efficiency. Analysis relied on a software for logistic regression, examining links between demographic details, clinical factors, and elements from the Health Belief Model, HBM, a framework that explains health decisions based on perceived risks, benefits, and barriers against vaccine uptake. To clarify for newcomers, HBM is like a psychological map that predicts why people might avoid or embrace preventive actions, such as vaccinations. Results. Out of 402 participants, a solid 79.5% of whom were women, the average age was 48 years, with a standard deviation of 12.4 years, spanning from 18 to 83. In the quantitative segment, 58.2%, 278 out of 479, reported being vaccinated against COVID-19, with 79.5% of those vaccinated being female. After adjusting for various factors, key associations emerged: secondary education or beyond boosted chances, adjusted odds ratio, AOR, 2.26, 95% confidence interval, CI, 1.20 to 4.27, p equals 0.011, as did a positive view of the vaccine, AOR 8.86, 95% CI 2.84 to 32.2, p less than 0.001. Interestingly, higher perceived severity of COVID-19 was linked to lower uptake, AOR 0.56, 95% CI 0.36 to 0.87, p equals 0.010, a counterintuitive twist that might surprise you. Qualitatively, personal beliefs, attitudes, and external influences emerged as pivotal in decision-making. And this is the part most people miss. While global averages look promising, subgroup disparities reveal deep-rooted challenges. Conclusions. Vaccination levels among cancer patients at ORCI stood at 58%, with advanced education, favorable vaccine perceptions, and disease severity views playing significant roles in encouraging uptake. Public health initiatives should focus on customizing messaging to these traits to boost acceptance. For context, this aligns with broader studies showing that targeted education can bridge gaps, much like how tailored diets help cancer patients manage side effects. Data availability and key abbreviations. The manuscript includes all data. Additional datasets are obtainable from lead or corresponding authors upon request. Abbreviations. AOR, adjusted odds ratio. CI, confidence interval. COVID-19, coronavirus disease. CORE, crude odds ratio. HBM, health belief model. HIV, human immunodeficiency virus. ODK, open data kit. OR, odds ratio. ORCI, Ocean Road Cancer Institute. SDIR, standard deviation. References, a foundation of evidence. This work builds on extensive prior research, including early COVID-19 outbreak analyses, Piri et al., 2020, Umakanthan et al., 2020, WHO reports on transmission and precautions, and studies on vaccine hesitancy in Africa, Achempong et al., 2021, Kawuki et al., 2023. Key insights from Mohammed et al., 2021, on perceptions in Malaysia, and Lewis et al., 2022, on vulnerable populations, underscore the global relevance. Cancer-specific findings from Rebus et al., 2021, and Nerona et al., 2021, highlight prioritization needs, while American Cancer Society, 2023, guidelines offer practical advice. Tanzanian contexts are covered in Msuya et al., 2023, Mfananga et al., 2023, and Amor et al., 2023, emphasizing local strategies. Models like Roberts et al., 2021, on confidence, and factors from Razai et al., 2021, Mudenda et al., 2023, and Bulasu et al., 2023, provide comparative lenses. Further explorations in Uganda, Konya et al., 2022, Ndejo et al., 2023, Education's Role, Thomas et al., 2021, and Hesitancy Studies, Sayalubinj et al., 2022, Salaam, 2021, Backhouse, 2023, Bergen et al., 2023, Marzo et al., 2022, Freeman et al., 2022, round out the evidence base. Methodological tools include Cochrane, 1977, on sampling and Viral Gaza et al., 2021, on overcoming hesitancy. Download the full references here. https://v2//references/10.186/s12879/025-11749-x?mark format =flavor references. Acknowledgements and support. The team expresses heartfelt gratitude to the patients who shared their experiences and to ORCI staff for unwavering support. No external funding was received. Authors contributed in-kind resources. Author information and contributions. Conception, design, planning, and execution: David Makako, Anthony Capesa, Nchuli A. Kapalog.